some household duties. But unmarried, is more independent, and maybe she's not so dependent on some mood of her husband or that he can change his mind. So all these risks have to be evaluated, and you just have to choose the variant which is best for you. But as for legal procedures, sometimes, for example, for the UK or for some other countries, we need unmarried surrogate, because she goes to the birth certificate, as I told you, then the later will be reissuance with the name of intended parents. By the way, is the husband of the surrogate mother aware about his wife's decisions? Does he need to sign anything? Yes, he's absolutely aware, and even sometimes we also invite him for the interview. He processed a special document which is called notary consent for his wife's participation as a surrogate. And each time his wife becomes a surrogate, each time we process a new notary consent. We also explain him all the legal details and possible risks and complications of the program, and ask him to support his wife as much as possible. Do you provide psychological support during surrogacy process? Thanks, Lyudmyla. Abia and Natalia work with our psychologist Alexander, who is very experienced in the sphere of psychological support of infertile couple and pregnant women. So he works as with our infertile couples as with the surrogate. He's all the time on phone connection with our surrogates. He calls them all the time, asks how are they. He's also available 24/7 when they have some psychological issue or depression or whatever, because sometimes it's a little bit difficult for them to be surrogate, but still all the time there is a psychological support, and especially after child delivery, if the surrogate a little depressed, we also can support her psychologically. Can you tell me a bit more on how genetic connection between parents is checked? Well, we are talking about DNA test. DNA test is required for Swedish embassy. It is done in a special Ukrainian laboratory which has governmental accreditation, and these medical tests are the medical tests of this laboratory are absolutely okay for Swedish embassy, and they trust them, we can say so. That is why after child registration at Ukrainian authority, we go to that medical laboratory and undergo medical test for genetic connection. We take saliva from a child and from a father, and later in the laboratory they are checked for identity, and there should be 99% of paternity confirmed. It means if we see the medical certificate with paternity confirmed, it means that child and father have 99% of genetic connection. I think do not see any more questions. If you, one more time, if you will have some additional, you can ask them a little bit later when we will move to discussion and our general questions. Video of our head doctor of the clinic.
Dear ladies and gentlemen, my name is Vladimir Kotlik. I'm head doctor of IVF clinic in Kyiv. The theme of my presentation is Scope of Reproductive Medicine Capabilities today. The number of European couples who struggle to have children will double in a decade. In the 3 couples could suffer infertility in 2015, compared with about 1 in 7 today. Falling birth rates are becoming a public health issue in Europe. The European Parliament concludes that reduced fertility is a major cause of its demographic decline, and that ART might offer one solution. The rising age at which couples first try for a baby, the increase of sexually transmitted disease and obesity, and all triggering infertility, especially among women, were also indications that male sperm counts and quality are in decline. In our clinic, we provide office we provide full range of up-to-date infertility diagnostic and treatment services, such as in vitro fertilization, intracytoplasmic sperm injection, artificial intrauterine insemination, oocyte and sperm donation, sex cell and embryo cryopreservation, reimplantation genetic diagnostic, surrogacy, and others. Owing to experience of our specialists and up-to-date diagnostic methods in the course of preliminary examination and treatment, it often turns out that a couple doesn't require high-tech and costly reproductive procedures. We pay special attention to preparation of our patients for ART programs, consultation of gynecologists, specialists of reproduction, consultation of obstetrician gynecologists, angiologists, full spectrum of ultrasound diagnostic, treatment of uterine cervix pathology, digital colposcopy, hysteroscopy, inspection of the uterine cavity by endoscopy, program of controlled conception, follicle measurements, genetic examination, and full range of laboratory diagnostics. The reproductive clinic offers a comparative medical examination, including all essential medical tests in its own campus laboratory, prenatal screening, infection-preventing embryo development, sexually transmitted disease, all types of blood tests, examination of all body organs. Pre-implantation genetic diagnosis, also known as embryo screening, is a technique used in vitro fertilization to ensure that a baby doesn't process no genetic defects to other parents. PGD is used to look for a specific disorder in couples with a high risk of transmitted and inheritable disease. Embryos are screened for a chromosome aneuploidy, chromosome abnormality, to increase the chance of ongoing pregnancy, for sex selection for non-medical reason. In this picture you can see success rates for IVF, ICSI for a period of 2010. On a regular basis, our experts take part in conferences and seminars held both in Ukraine and abroad, constantly improve the professional skills and advance the training courses, and share their experience with their colleagues from domestic and foreign clinics. Our specialists are members of the following organization: the European Society of Human Reproduction and Embryology, HREP, and the Ukrainian Association of the Reproductive Medicine, UARM, and the Happy Parents. About our results, we have more than 20 medical specialists of higher category, nearly 600 IVF, ICSI cycle annually. More than 35% of our patients are foreign citizens. Nearly 50 cycles of ART per month. Total pregnancy success rates about 40%. New clinic providing VIP services for foreign patients to be opened this year. Thank you for your attention.